What are the best methods for storing your peptides, guys? Semaglutide, tirzepatide, BPC, CJC, 1295, TB500, thymosin alpha 1, guys. Whatever peptides you are, you're going to want to watch this video. If you're new to my channel, hi, I'm Dr. Jones, a holistic obesity expert, and I specialize in sustainable weight loss, anti-aging peptide therapies. Two categories, because there's so many different forms of peptides and medications. Injections are probably the most common, but then there's oral, pills that you swallow. There's creams that you can rub on your body. There's nasal sprays, right? Nasal sprays and injections, what do they have in common? They're in solution, right? And when peptides are in solution, they will degrade over time. And that degradation process is inevitable, and it's sensitive to temperature. The higher it is, the faster those peptides break down. Some peptides are extremely unstable, right? A peptide called MOTS-c, for example, literally breaks down. Even some of the studies show while it's in your body, it's already breaking down before it even can get to the area that it needs to act on, which is your mitochondria. Pretty wild. That's an extreme example. And then you have some very stable peptides like the GLP-1s. They actually last a while, and then you have everything in between. So if you got a nasal spray or injection, keep it in the fridge, keep it cold. When you travel, keep it cold. Don't freak out. One day is probably fine, depending on the peptide, but don't let that happen, right? This is an investment in your health that's not cheap, so keep it cold. Now, if you have a cream or you have an oral troche is a method of peptide administration where you pop it in between your gum and your teeth, and it's got some sublingual absorption through the buccal mucosa. That one, along with the pill, that's stable room temperature, and so you don't have to stress as much. But in our case, we tell our patients to keep the oral troches in the fridge because they pop out of their containers, easier. But regardless, those two forms are stable. Injections and nasal sprays, keep them in your fridge, guys, and you'll do great. If you guys want some coaching, maybe you already have the peptides medications, maybe you're trying to use the peptides, but for sustainable weight loss and you're just freaking lost, you don't know where to go, or maybe you are dealing with some issues and you want to have a proper functional consultation so that we can set you up for success, click my profile icon, scroll to the top, click that link there, and we'll get you set up for a free consultation, guys.